Well, I've got with me today Dr Dabali, and we're going to go through the most recent asthma deaths review and talk about how that's influenced us here at Latham House and some of the details from within that. Welcome to the podcast studio, Dr Dabali. Just tell me a little bit about the review and some of the background.
Thank you, Dr. Borrill, for having me here. It's quite interesting about the recent National Review of Asthma Deaths. The reason for this review was to see whether we could learn anything from that, and we have got some interesting points to discuss about. In the year 2012, when they did the review for all asthma deaths, it was quite shocking that about 45% of patients did not seek any medical attention, and about 50% of the deaths took place between 8 o'clock and 6 o'clock, that is from 8 a.m. and 6 p.m., when the GP practices are open. So it just means to show that people are not aware of seeking help for asthma. Besides that, there were patients who have been coming into the GP surgery and asking for repeat prescriptions without being reviewed by the doctors. It's shocking that about 56% of patients had been taking what's called a short-acting bronchodilators and had at least 6 prescriptions of them in the last 12 months. And about 40% had received more than 12 reliever inhalers in the last 12 months prior to the death, which constitutes significant overuse and is an indicator of risk.
So are we saying the people that use their reliever inhaler a lot are at risk of problems with their asthma?
Yeah, that's correct, Dr. Borrill. It means that patients are using these relievers and actually not getting enough preventative medications, and therefore they're at increased risk that the asthma is out of control, giving rise to complications, including death.
So anyone who's using a lot of their blue inhaler really should be looking to book in with the asthma nurse or one of us for a checkup.
Yeah, that's absolutely correct. That's the key message of this review, that doctors should be reviewing the patients, and the patients likewise should be seeing the doctors if they feel that the asthma is not under control.
So thanks for that sort of review of the asthma deaths order. I'm sure we'll come back to that in a bit as well. So how would we actually diagnose asthma here in the clinic?
As you know, Dr. Borrill, asthma is a long-term condition that affects the airways. These are the small tubes that carry air in and out of the lungs. And if you have asthma, your airways are always very sensitive and inflamed or swollen. So therefore, you may have symptoms of asthma, which could be whistling noise or wheeze, as we call it, in the chest, a feeling of tightness in the chest, people getting shortness of breath, and some may be having cough symptoms, which may be either in the daytime or it may wake you up at night as well. However, asthma at times is a very serious condition, as if not treated properly can lead to life-threatening asthma attacks.
So if someone's got those sort of symptoms, obviously you'd encourage them to come in and see one of the doctors or nurses here at Latham House. But what would they do to try and take it to the next step?
There is no single test to diagnose asthma. Your doctor will ask some questions which could be relevant to say that he or she has got symptoms of asthma. And it will be followed up by doing some tests in the clinic, which could mean that they will be subjecting them to what's called as peak flow measurements or spirometry. And sometimes there will be a combination of tests, and they can sometimes do tests called reversibility tests. If it is likely that you have asthma, you will be started on some medications and given advice on how to manage your symptoms. And it's important to go back to your doctor and check that the diagnosis of asthma is right, if after trial of asthma medications your symptoms have not improved.
Thanks. So that's a little bit about, if I think I've got asthma, I can come in and we'll go through some tests and decide if I've got it. What's likely to trigger off an attack of asthma?
A trigger is something that makes your asthma worse by irritating your airways. Everyone's asthma is different, and you'll probably find you have several triggers. The most common ones could be something like a common cold or a viral infection, or it could be as simple as coming in contact with a dog or a cat. Some of the common triggers include cold, house dust mites, furry or feathery animals and birds, pollens, perfumes, and sometimes chemicals at workplace like paints. It can also be triggered by exercise, stress and emotions, changes in the weather, as example, and also certain medications, which could be given by a GP or something which you can buy from over the counter.
So it's always important that if you've got asthma that you let people know if they're prescribing you medications just in case they haven't picked up on that though.
Yeah, it's absolutely important that people who got asthma should be aware that should they see somebody else, say for example a doctor or even a pharmacist, they should let them know that they have this condition so that they can avoid certain medications which can trigger asthma or make it worse.
Well, thanks for that. So often patients talk about their blue inhalers or their brown inhalers or their green inhalers or their preventers or their relievers. Just talk me through what all those sort of terms mean.
Yeah. Most asthma medication come as inhalers so that the medication is breathed directly into the lungs, and that's the most effective way of taking your medications. The name blue or brown inhaler comes from the fact that some of them are preventive medications and some of them are relievers. Usually the brown inhalers, as we call it, contain steroid preparations and they will help to prevent asthma from getting worse, whereas the blue inhalers contain something like salbutamol, which will prevent people from getting their asthma worse, especially when they come in contact with the trigger. So they are called as relievers. Having to use relievers very often is a risk factor because it means that the asthma is not under control. So if you happen to use a blue inhaler or a reliever for more than 3 times a week, then you should be wondering whether your asthma is under control or whether, if you're not been taking any preventative medications or a brown inhaler, you should be started on one. However, you should speak to your doctor or the asthma nurse in the practice to make sure that you're on the right medications.
I think that was one of the things that came out of the review there, that patients using their reliever too often were putting themselves at an unnecessary risk of a severe attack or, unfortunately, even death. Is that right?
That's correct. If you happen to take the blue relievers to relieve the symptoms, you're not correcting the underlying problem, which is often controlled with brown inhalers. So if you're having to use the blue inhalers to just control your symptoms, your asthma can get progressively worse to the point that you may suddenly have a very severe attack of asthma, leading to, sort of death literally.
So you've mentioned good asthma control there, but what does good asthma control actually mean?
Good asthma control means that you don't have any symptoms of asthma. That is, you do not have symptoms of asthma either during day or night. You may not need to take any reliever medications at all. And also you're able to do all your usual activities, including exercise or your other activities of daily living. And you don't seem to have any asthma attacks or flare-up. So this constitutes good asthma control. However, if you're using your reliever inhaler for more than 3 times a week, or if you have symptoms of wheeze all the time, or waking up at night due to asthma, it means that your asthma is not under control.
So surely if I've got asthma, I don't need to speak to the doctor every time I have a slight wheeze or a cough. There must be some sort of self-management there. How do I manage my own asthma?
Yeah, that's a very good question, actually. People who have got asthma should know what this condition means to them, and they should have a fair idea about what medications they're taking and how they should be taken. Now, every patient with asthma should have what's called as a written personal asthma action plan. This plan will give information about how to manage the symptoms, how to use the medications in case they have a flare-up, and gives us a roadmap as to the patient as well as the doctors on how to manage these day-to-day fluctuations in asthma. It's also important that patients understand what medicines they are taking and for what purposes, and to ensure that they don't run out of medications or inhalers. It's also important that they know how to take them and to get their inhaler technique checked, either through the asthma nurse or through the GP or even a pharmacist. It's important that they take their medications regularly so that they don't allow the asthma to become worse, and they can monitor their own symptoms and know what triggers cause this asthma. Finally, they'll always get information through the asthma nurse or the GP, and there are a couple of good websites as well which will give good information about patients on how to manage their asthma condition.
Well, thanks for that. And we've gone through briefly the report there, which sort of highlight importances in patients taking their medication properly, importances of practices making sure they bring patients back for reviews. I understand a bit more now about how we diagnose it, my responsibilities as a patient for the management, What are we doing as a group of doctors and nurses here at Latham House to help our patients with this chronic condition?
It's extremely important that patients understand the basis of a regular follow-up and what medication should be taken for these symptoms. They should be attending an annual asthma review with the doctors or the asthma nurse, even if the symptoms are well controlled, just to make sure that their inhaler techniques are checked and they know how to use the medications properly. More so, after an acute episode of asthma, it's extremely important that you should be seeing your GP or the asthma nurse. And here at Latham House Medical Practice, we will be able to facilitate that by making appointments with the asthma nurse after an episode of an acute asthma, so that things will be reviewed and you will be sort of given more confidence and advice regarding management of these patients. If somebody has been using their inhalers without getting their asthma checked out recently, it's important that they contact the surgery and make an appointment with the asthma nurse again to ensure that your medications are appropriate. I would urge patients who have got asthma to get in touch with the asthma nurse and get their medications and asthma reviewed.
And lots of people do say the thing about access, but it is an important investment in their health, isn't it? And I think taking a little bit of time out of their day to come and see us, and there are extended hours clinics that the doctor's certainly running to try and fit around this working time, but taking a bit of time to invest in this chronic condition could literally save their lives.
Yes, it's absolutely important that even during the asthma review, it was found out that patients who lead a chaotic life are more likely to end up with problems with asthma, especially asthma deaths. So it is important that they take some time out to get their asthma reviewed, especially if they're having to use their reliever medications more often, or if they're not very sure about how to manage their condition, and most importantly, if they don't have a personal asthma plan.
Many thanks for coming to have a chat with me today and allowing our patients to understand a little bit more about asthma and what we do here at Latham House to make sure that their health is a priority.
Thank you, Dr. Borrill, for having me. Thank you.